played professionally, was able and blessed to play 13 years in the major leagues. What's my life going to be like in my 40s? What's my life going to be like in my 50s? I've had 17 surgeries already. I'm already tired of going under the knife again and again and again. To be honest with you, I was skeptical because I thought I would have to need another surgery. I think sometimes we are afraid of change.
We're happy to have Eduardo Pérez here today to talk about stem cell therapy for athletes, for professional players, or anything beyond everything.
Well, thank you for having me, Dr. Yi. I'm really happy to be here with you.
Yeah, so do you want to talk a little bit about yourself and how you got into stem cells? I know even before I knew you, you already had stem cell at some point.
Yes. So I played Major League Baseball. I played a lot of sports when I was growing up, but I ended up playing collegiate ball at Florida State. And then from there, played professionally, was able and blessed to play 13 years in the major leagues. And once that career was over, and once a lot of the surgeries that I had as well, through those years that I played, just abuse on the body, you could say knee surgeries, elbows, Achilles tears. I've had pretty much every joint, you could say, from wrist to elbows to shoulders, both shoulders done. So I was wondering, what's my life going to be like in my 40s? What's my life going to be like in my 50s? And the first time that I was able to have an experience with a stem cell was actually in Miami, and it was done because my shoulders, I pretty much almost had like frozen shoulders, could not raise them over my head. And I was actually, they tapped into my body. They did the procedure that you know very well, and they took my own stem cells and put them right back into my body. And fortunately for me, it worked. It worked that time, and I haven't had any issues since. They had done MRIs. The MRIs showed that I had tears in it. And then after that, I have not had any issues with my shoulders. I've been able to throw when I need to throw. I've been able to do my workouts and everything was really good. Fast forward, I meet you. And this is a whole different ballgame. This is an entire different ballgame because I had knee surgery on my left knee, and it didn't really take well. And the doctor was thinking, well, we might have to go back in there, do an exploratory to see what's going on. And when I met you, we ended up doing the umbilical cord stem cell treatment. And to be honest with you, I was skeptical because I thought I would have to need another surgery. I'm an expert in surgeries, being had so many. Fortunately, and I knock on wood, up to now, that left knee has been fabulous, and we're going on 3 years with that left knee.
Yes. So then
my left ankle, getting out of the car, I twisted my ankle because I stepped on a wrong side maybe like 9 months ago or 10 months ago, and I thought it would go away because it was just a little strain. That little strain, it was hard for me to walk when I wanted to walk on the beach on the soft sand. It was hard if I needed to turn really quick one way, and I could walk straight, but it was very tender, very sore. I found myself taking a lot of anti-inflammatories, acetaminophen, and I wondered, okay, what do I do next? We then decided to take a trip to Medellin. And lo and behold, it just popped in my mind. I was like, wait, Dr. Yi's here. And we ended up going to see you at your clinic, at your compound, which is unbelievable, by the way. And when we went there, you ended up not only treating me for the ankle, which, by the way, an awful disclaimer, at that moment, it hurt a lot. The ankle, but you hit it right on the point. And you were able to put, if I'm not mistaken, 50 million stem cells into that ankle, into where it hurt. The first day, very sore. but we're on day 3, I believe, right now. Day
Yes.
3 or day 4 right now.
Yeah.
And it's sore, but it's a different sore than what I had before, even day 1, and even before before I went into your clinic. I will say this: I know they're working. I do the red light treatment like you tell me to do, and so far I've been patient. I've been trying to lay off a little bit, let the healing happen, moving my ankle as much as I can all around, and doing movements that I couldn't do before. So I know that little by little it's working, and I just have to be very patient with it. But very happy so far with what has happened. Also, I was able to also get 100 million stem cells through the IV. So umbilical cord stem cells through the IV, and woke up yesterday and today. I didn't even think about it. I didn't have to even stretch. I just woke up and went. So that right there is going to even get better and better as the days go by.
Good. So you feel the effect of the IV, even though you didn't know what IV
I didn't go in for the IV, but I was like, you know what? 1 in Rome, 2 as Romans, and I went in there and I was able to take advantage of what you were able to offer and let us know, and for that I'm grateful.
So how did your wife Mirva feel after the IV? Did she feel anything?
She does. Immediately, she's like, she got up, as a matter of fact, this morning, and she's like, I'm going to go work out. I'm like, by the way, we're recording this on a Saturday. And she woke up and she went to work out. I'm like, what are you doing? You never work out on Saturday. She goes, I want to go work out. I'm like, okay. I'm not going to tell her, because if I tell her, then I just have to let her figure it out on her own. Each one has their own journey, I feel.
So the reason she never works out on Saturday is because she's tired?
No, I think the reason she works out really hard from Monday to Friday. And usually she takes Saturdays off. So takes Saturdays off. She'll walk. She'll do something light. But she went straight for her cardio, and she was ready to go.
Yeah, I know she does a lot of workout, right?
Yeah.
She goes to gym all the time, building muscles.
She does. She needs to keep strong. She's seen what age, I'm 3 years older than she is. So she's seen what the future might look like for her 3 years down the road. And she wants to make sure that she stays in great optimal condition. Plus, and I can't speak for her on this, but she's very good when it happens to, when it comes down to perimenopause and all that stuff. And she wants to make sure she takes everything she needs for her body to be in optimal condition, to take away a lot of the abuse from estrogen, from whatever that she needs to do to get it right. Then she goes and she does her research, and she asks a lot of questions. And she asks you a lot of questions as well.
I know. And takes 2 years before she actually decides she wants to do it herself.
Yeah, but as soon as she walked into Surgeries, things changed. Things changed for her, and she walked in and she felt very comfortable with you and with your staff. And I think that's when she's like, okay, I'm going to do 100 million through the IV as well. And it's because we were running out of time, because if not, I think she would have just set up camp there.
So when do you guys want to go there again?
I'm telling you, she's already making plans. As soon as my schedule slows down, I think everybody has to do their own research, right?
Yes.
Everybody is entitled to their own opinions. We've done our research. We've had a lot of assistance from you. We've gone online. We've listened. We've read. And I think the biggest tool one can have is education, right? And educating oneself with what's going on in right now with medicine, with advanced medicine. And I think this right here is something that is, it just makes sense. It makes sense. And for my body, it's worked. And I think sometimes we are afraid to change. I think it's a natural instinct of any human. It's in any capacity, in any job you do. It's like, oh, really? This is different. But it's real. It's real. And and being in the business that I am in, which is broadcasting Major League Baseball games and being around the game and caring and seeing the athletes go in max effort and their bodies sometimes not being able to hold is hard to watch. I'm 56 years old. I've had 17 surgeries already, right? And I really do feel that if I would have at least been able to do this therapy during the off season, as soon as the season ended, the inflammation would go. I think the biggest cause of all of this is you want to perform. You want to be on the field. You want to participate, not only for yourself, not only for your family, but for your fans, your city. And you know that your time is limited as an athlete. So you want to take advantage as much as you can. And for me, it just makes a lot of sense that any athlete, it's not just in baseball, it could be in any sport, should look into this and see how they can at least get that cell to help you and reproduce and be able to take that inflammation out, see if there's something wrong with a certain part of your body to so it can level out again. The body is also meant to be able to let it rest. And I think with this stem cell therapy, the umbilical cord stem cell therapy, it's for me, it's a no-brainer. I just wish I was 26 because I'd be visiting you every year.
So when you first started out doing your shoulder with stem cells,
Yeah, I was skeptical.
did you ask your doctor, like orthopedic doctor, about it? And then they were saying, oh, it's not proven. You better off doing
No.
steroid injection.
No, to be honest with you, no. I with my orthopedic doctor, I went in, I had the MRI. They're like, you've got a tear. We can do PRP, is what they told me, because we're here in the United States and it's not regulated here in the United States.
Right.
But we can also do the stem cell therapy, but it comes out of your own stem cells. Now, let's think about this. This was probably, I want to say, in 2017 when I had this done. So I was 48 years old, around there. So my cells are how old? 48. Think about your body at 48 and think about an umbilical cord stem cell,
Which is zero.
which is zero age, and it is ready to work. It is ready to grow. It is ready. It's the way it was explained to me before I met you is just think about a colony of ants, and the ants are workers, and the ants want to fix. They want to build. They want to continue to. They don't stop, right? So with the umbilical cord stem cells, these are just ready to take orders as well. They're ready to learn. They're ready to go in and start reproducing and start building and start making everything around your body stronger and taking out the stuff that's not supposed to be there. And while you sleep, while you rest, while you, they're in there working. My 48-year-old stem cells, they're a little tired. They sort of die off a little bit early because it is what it is. It's that time. But they were good enough for my shoulder.
Right.
Now we always seek and strive for, okay, what's next? What's better? In the United States, they're not allowed. FDA not approved. I don't know if it's big pharma. I don't want to get into that political side of it because that's my education gets there and as far as I can go. But at least for me, being able to go to your clinic, it's a no-brainer. That's how I feel personally. And then when the doctor told me, he goes, well, we can do, going back to the story, we can go and do PRP. I said, okay, what does that do? And he goes, well, it spins the blood. It tells me all the stuff. It puts it back in, and I'm like, well, what about the stem cell? And he goes, well, that works, but we're just not allowed to do it. So you're restricted here.
If this episode has been valuable for you in any way, please leave a review or a comment. It will really help more people to find reliable, research-based information in a space full of noise.
So your orthopedic doctor actually is open-minded about stem cells.
My orthopedic doctor is.
Yeah.
Because I think every orthopedic doctor every doctor that does PRP understands it.
Yes.
I think every doctor that does the stem cell from your own body understands it. Clearly, it's just not allowed here in the United States.
But I have many people who actually, they consider stem cell treatment for their joint issue themselves. Then once they ask their doctors, then their doctors would tell them, oh, it's not proven. It may cause cancer.
Well, of course. Of course they're going to tell you that. Again, do your research. To me, that's one opinion. And we're based off opinions. And I respect every opinion. That doesn't mean it's the right one. And that's why I continue to say, look, just educate yourself, look into it, understand the science of it. And if you don't, continue to ask questions and don't just take it from one person. I mean, diversify your portfolio, just like when you don't put in your money all in one nest, you have to diversify it. Diversify what also goes up here so you become more knowledgeable. And I think the power of not just talking is the power is listening. The power is being able to make your own decisions and understand it. There's a reason why, at least in my sport, when someone would, let's say, hurt their shoulder or hurt their elbow or hurt their knee, they go in for a second opinion. They do. And maybe there's another option. And I was fortunate years ago to go into a second opinion when I was playing in Japan. They flew me to the United States, and my knee was killing me. I wish I would have met you back then.
Was that the same knee, the left knee?
No, this was the right knee.
The right knee.
And my knee was killing me. And the doctor's like, oh, that's patella. And that's a tough surgery. And then I had another MRI. And the other doctor's like, that's not patella. That's not a patella situation. Your patella's intact. This is what we have to do with this surgery. And they did it. And I was able to go back on the field 5 months later and be able to play. So the second opinions are important. And I understand sometimes people have their doctors that they trust or their orthopedic doctors that they trust and or even family doctors. But if you hear something, don't you want a second opinion? For me, if it's something that you're like, is there another option? Is there another avenue? And I was fortunate that the people that actually recommended the stem cell therapy doctor when I had it here in the United States before I met you were my parents. And my parents, who right now I'm 56, they're 82, think about it. They were open-minded. And I'm like, if they're open-minded, I have to be open-minded. Okay, what do we... And it was that therapy was working for my mother, but then again, when she was doing it, her cells were 70 some years old.
Yeah.
So you'll be visiting. You'll be getting a visit from my mother.
Okay, and does she want to go to Colombia or she? Well,
she's not afraid to travel.
Okay.
So that's a good thing. So we'll find out how we'll be able to get her to Colombia, but I'll end up having conversations with her.
Okay. So mentioning your father is the Hall of Fame player.
Yes.
In baseball.
Yeah, my father's Tony Pérez. He played in the major leagues for 23 years. He's in the Hall of Fame. He's from Cuba. He left Cuba before everything else went awry up there, but he had an unbelievable, successful career. And my father played those 23 years without being put on what they called the disabled list. He never missed games because he was hurt. He would play hurt. They would drain his knee the entire time. He ended up having knee surgery after he retired. They would drain liquid out of the knee. Generation after generation, you just put a lot of abuse into your body. And my father, knew at that time, the rules were stay out of the training room. That's you can't make the team out of the tub, and you just have to sacrifice. And a lot of people from that generation sacrificed their bodies, as I did then, and as players do now. Since he's had knee replacement, but he doesn't take anything back because he had to do what he had to do. But he's another person that's very open to the medicine as well. He was the one that was like, you have to do the stem cell. You have to do the stem cell. So So I know they're definitely open to the modern science in their sense, instead of less invasive. And I think at the same time, you have to give your body a chance to heal, and why not give it a little help while you're at it?
So does your father have a lot of other joint issues besides
No,
knees?
believe it or not, he does not.
Okay.
He does not. It's just it was that one knee. I still think he might have to do the other one, but I think it's with age. And I think this is where you don't have to be an athlete to have the umbilical cord stem cell surgery, right? We've seen a lot of people that have aches and pains. We've seen a lot of people that have inflammation, and this is where it plays. The older you get, the slower you get. The older you get, your joints, and that's why they tell you, you have to keep your muscles strong, but you have to keep your tissues strong. Cells is the ultimate in all of that. Again, people have to do their research. Continue to watch not only this podcast, but other podcasts that you have done as well, to educate oneself and to be able to make your own decision for your body.
So your father, he only had one knee replaced.
He had only one knee replaced. My mother who was not an athlete and who did not and has never done one single exercise or sport ever. I don't even think I've seen her wear tennis shoes. I need to see that. I've never seen that. She's had not only her hip replaced, she's had 2 replacements also on both on each knee. So, it's, again, I'm not only just talking about the athletes here.
Right.
That's my experience being an athlete. But also I have experience of seeing my mother, who was not an athlete, go through a lot of the aches and pains that people go through. And so, she continues to have issues. If she continues to have open wounds right now with some sores that she has in her left leg, that we've had conversations with you as well, that the stem cell therapy could help as well there. Not only injecting it into that area, not only doing it through IV, but also doing it through putting stem cells on a padding for topping. I continue to be in awe of the science, and I think not only you have educated on us, but we've also done our research, and so far we've liked the results.
Okay, so then for active athletes right now, like a lot of them also are concerned about doing this unproven treatment, whether it will affect their drug testing, their performance, because they just don't know, because they have doubts. And even their team doctor may tell them, oh, it's not proven.
It's not proven. I think the first thing people should do is understand, okay, what are you going to put into your body? Professional athletes are told by the Players Association, they're told by Major League Baseball, they get a list of the things that they cannot take. They get a list also, and if they have any doubts, they can always call their trainers and find out, okay, what is it? Is it legal? Is it pure? Is it what the label says? It's also trusting the doctor that is putting whatever they are putting into your system. Unfortunately, I do believe there have been athletes, and I won't just say baseball players because that's my line right there of work. There have been athletes that have been lied to. So there is a trust to all of this as well. There's a trust factor to this. Now, it's important to also know what is it that's going into. It's important to know what the process is. Where's it coming from? Wait, this is coming from your own body, right? We take the blood out, you draw the blood out, you spin it, you take in my case my plasma, and what you put into it is the umbilical cord stem cells. And in this case, and let's say it's my ankle, or let's use the IV, 100 million stem cells. That's put into the IV. But what goes direct into that joint, in this case, my ankle, the 50 million, there's nothing else but just my plasma and the stem cells.
Right.
And that's the part that, and I would love Major League Baseball to, in this case, to with the list, is this or is this not a performance-enhancing drug? Keyword drug. There's no drugs going into this.
Exactly. That's not even.
Right. And I think that's the interesting part. Again, if I'm an athlete, if I'm a baseball player, today's world, my season ends, I'm coming to see you, right? Because I need to be able to make sure that the inflammation is out of my body, to let my body then restore, to help the cells restore whatever aches and pains I had in a certain area, if it's through the IV or if it's a direct through a spot, and then allow the body to then heal, and then start your workout regimen. If it's a month and a half after, if it's a month after, start your workouts, intensify the workouts, start the throwing program, start the hitting program, and then you go from there and you can start the season ready to go. This isn't a quick fix. And I think this is what people think. Okay, it's not like like if it's an anti-inflammatory shot or a steroid shot right to the joint that all of a sudden 2 days later you feel great because the inflammation is directly taken out. Yet it's not good for the tissue. This is actually good for the tissue, but you have to allow the tissue to rest. And that's why every sport from hockey, basketball, football, baseball, the four major sports in the U.S., that's why you have that time off to be able to let it heal. But how about if you have an accelerator to make sure that you understand and it understands your body well, and it's through stem cell therapy.
So would you also recommend people who, athletes, active athletes, professional athletes, when they get injured during the season, like if, say, go back 26 years or 30 years when you were playing, if you would have known, of course, back then we didn't have the technology. So if you knew back then, if you could do stem cells instead of doing so many surgeries, I think that would be beneficial to you.
100%. I mean, I wish, because the joy of the athlete is to be able to play. It's to be able to participate. It's to be able to compete. Now, I'll say this. Look, I tore my UCL and everything, and I needed to have the surgery. And sometimes you need to have the surgery. I'm not saying that this would have taken any surgery out of the question, but then you can also then allow it to heal by then doing the stem cell therapy after the surgery. And that way the tissues now have a better opportunity of healing quicker, safer. So it's not that this is going to just all of a sudden replace surgeries. It'll help you mitigate it. It'll help you maybe not have it, because, again, what causes all this? What causes pain? It's inflammation that causes pain. What causes time for you to miss? Inflammation is the key here. So the stem cells help that. The stem cells help rebuild that tissue. And for me, I don't think I would have had 17 surgeries. Maybe I would have had just 8. Maybe I would have had just 4. I would have taken that, right? And instead of all the surgeries I've had at my age of 56, I retired. And I remember Mirba telling me, when you have your 10th, you're done. And I had my 10th, and I listened to her because I wanted to be able to play with my kids when they grew up. I wanted to be able to still be functional at an advanced age. I wanted to travel. I've been able to do all those things. But the key to all of this is, how do you maintain your body, what you put into your body? We put our fuel, right? We eat well. We have to prepare well. We do our weight training. Why not help your body out as well and do your research as an athlete with this? And even if you're not an athlete, don't you care what you put into your body?
Because a good example is shoulder. Because if you didn't do the stem cell back then, most likely you would have the shoulder surgery, rotator cuff surgery.
100%. See, that's one of them. And since, fortunately, I have not. I've had both shoulders scoped in the past when I was younger. I wish they would have done this when I was in college and I had my first one. And my first surgery was my right shoulder out of all. I think this could have been an opportunity for me to allow to heal. We've seen athletes, in my case again in baseball, where we hear, well, they did a PRP. And I'm already, at the beginning, I was like, oh, what is that? Before I even knew about stem cells. I'm like, wow, that's genius. No, this is genius. This is genius. Look, again, I think people have to go in and do their research. They have to understand it. Athletes, they're always looking for an edge. I think the edge is the biggest edge is availability. Availability to play every day is your biggest asset. And there's a phrase that I learned years ago that your best ability is availability. I think this allows you to be available.
And also your recovery time from doing either PRP or PRP with stem cells is much faster than going through surgery.
Tell me about it. The rehab. I'm a professional physical therapy rehab guy. I know I have them all on speed dial. All my therapists, I have them all on speed dial. If I call one up right now, they'll be like, "Hey, Eddie, what happened?" So they know. And look, it's the one thing that I really have enjoyed from getting injured is my relationships that I've had with people that I wouldn't have met if it wasn't for the injuries. But look, I don't wish the therapy all the time on people. It's maintenance. You got to do maintenance. You got to do maintenance on your body. We hear every time people talk about, well, I'm going on a diet, or I'm too heavy, or whatever it may be. You have to care what you put into your body, and that's not just through your mouth. It's a being able to allow the body to heal, and to do it the right way in a quicker way, so you can be out there and be functional again.
Yes. So, and also for some injuries, for example, if you have a Achilles tendon rupture or ACL tear, then sometimes you do need to have surgery. However, I did have my ACL tear in one of my knee, and I never did the surgery. I just did the stem cells.
You did? No kidding.
Yeah. But because I'm not a professional athlete, so I don't need to perform in the speed of running or anything like that. So I can live by without the surgery.
And I understand that because, again, I would have had to have gone back to have my left knee operated again. And I was like, something's wrong here. And when you put in the stem cells there, and I was like optimistic, I was like, I hope this works. I was like, wait a second, what's going on here? It was the first couple weeks still sore. Then little by little, it tapered off to the point where I'm like, not even thinking about it anymore. I just, people just, one takes it for granted, right? Oh, my knees are great. Great, but when it's not, don't you want it to feel right? And for me, that was an important thing. And I needed to give it a shot because, to be honest with you, I'm already tired of going under the knife again and again and again.
Yeah, and every time you go under the surgery, you actually create more scar tissues in the joint. And then that will create more inflammation down the road, even though after the surgery.
Right, and this is the thing. And I love my orthopedic surgeons and everything because I've got to know them really well, right? They're another group that's on speed dial, and they explain it to you. If it's in the case of your knee, if it's a meniscal tear or something like that, look, the meniscal, when it comes off the wall and everything, and you see it when it comes off the bone like that, and it gets stuck, so you can't like move it back and forth, and that's when, and what causes that for it to get stuck? Inflammation. It causes inflammation. So it's not going to take the meniscus, the tear, it's not going to take it out of there, but what it will do, it'll minimize the inflammation.
Yes.
So you don't have that pain. Wear and tear in our bodies at 56, whoever's out there at 56 is going to have it. Doesn't matter if you're an athlete or not. It's okay. How do we maintain? How do we keep our frame strong? Yes, we have to lift weights. Yes, we have to walk. And yes, we have to be able to eat well is right to keep our frame from doing all that stuff. But at the same time, you also, and look into it. That's all I'm saying is look into it to see how else you can enjoy life and not be sore and not be inflamed. Stem cell therapy does that.
Yes, it would be great if majority of the active players, they would use stem cell treatment regularly, say once a year or twice a year. Then I think all of them will be able to perform better with less injuries too.
Absolutely. Absolutely. Guys that are training right now, they're throwing right now, getting amped up for spring training that's coming in right now. I think, again, I would have wanted to do this treatment. I would have done the IV if I felt good after the season. And okay, how do I now get my body right and get it prepped for the next season? I'm going to take some time off with the family, but before I do that, I'm going to go see Dr. Eve. In my case personally, I would have taken the 100 million stem cells, and maybe it could have been a little bit, more. I have no idea. Depends on the person.
Depending on the weight and how much inflammation you have.
Exactly.
Yes.
It all depends on that person. Every individual is different, and I know you'll analyze that as well, and then go from there. That's for you to decide for that player to be ready to then start their workouts. If they have an acute pain, if it's in their elbow or in their shoulders, then you'll go straight to that joint as well as the IV treatment. So it all depends. Each individual, if I'm not mistaken, and I don't want to speak for you on this, would be a lot different. I can only speak from my experience. And from my experience, it works. It works because season ends. If you don't make the postseason, October 1st, now you have the entire month of October, November. You can have that off, and then you can start your workouts, start your regimen, and then amp it up, ready to go for the season, for the spring training season that starts in February, mid-February, and the regular season starts beginning of April, late March. I mean, and then the cycle continues. You do it all again, during, and you allow your body to heal and rest and repeat. To me, it would be a no-brainer. Unfortunately, I'm not 22 anymore. I'm not 26 anymore. I'm not 30 anymore. I'm 56, so I can't get back in uniform and play. But, man, I wish I would have had it back then.
I know that will give you a super boost.
100%.
Yeah. So very nice having the conversation with you today about how stem cells can help professional athletes. And we're going to talk more about what they need to do to really tone up your body with the stem cell help, but also you need to incorporate other things in the next episode.
All right, let's do it.